You've noticed your penis curves to one side, especially when it's soft, and you're wondering, is that normal? Should I be worried? In this video, we'll explain what a curved penis means when it's flaccid, what's considered normal, and when it might need medical attention. Hi, I'm Dr. Zoe Hartley, and here on this channel we talk about real men's health topics, especially for men over 50. Let's clear up the confusion around penis shape, natural curves, and what to expect as you age. First, a curved penis when soft is completely normal for most men. Just like noses, ears, or feet, penis shape can vary. Some curve to the left or right, others slightly up or down. Why? 1. Natural differences in tissue structure. 2. Uneven blood flow. 3. Minor differences in skin or ligament tension. These are all harmless and part of your body's natural blueprint. As you age, you may also notice changes in curvature. This can be due to 1. Loss of elasticity in skin and connective tissue. 2. Past injuries or micro-tears during sex. 3. Minor scar tissue buildup. 4. Changes in blood flow or muscle tone. A slight curve when soft doesn't usually affect erections or performance, and it's rarely a cause for concern. Now, there are times when a curve could signal something more serious. Here's what to watch for. Triangular flag curve is new and getting worse. Triangular flag pain during erection or sex. Triangular flag noticeable lump or hard plaque under the skin. Triangular flag significant bend when erect, 30+ degrees. Triangular flag trouble with penetration or performance. These may be signs of Peyronie's disease, a condition caused by scar tissue buildup inside the penis. It's not dangerous, but it can affect confidence and function, and it can be treated. See a urologist if 1. The curve changes suddenly. 2. You're in pain. 3. You feel hard lumps or thickened tissue. 4. Sex becomes uncomfortable or difficult. Treatments can include physical therapy, medication, or in rare cases, surgery. But many cases don't need intervention at all. Most of the time, a curved penis, especially when soft, is nothing to worry about. It's just part of your unique anatomy. But if it's painful, gets worse, or affects your sex life, don't ignore it. In the meantime, take care of your general health. 1. Stay active and stretch regularly. 2. Avoid rough or aggressive sex. 3. Manage chronic conditions like diabetes or high blood pressure. 4. Get regular checkups with a urologist. So yes, a curve when your penis is soft is usually perfectly normal. But if something feels different or uncomfortable, it's okay to get it checked. Watch our next video for more. Can porn cause erectile dysfunction? Subscribe, give it a like, and let's keep these conversations open and honest.